Hello, welcome once again to Feel Good Services. My name is Philip Oforiye-Tumi. Today I'm going to be talking about bipolar. Bipolar is a condition that affects most people in the United States and around the world. The unfortunate thing is, in some parts of the world, it goes undiagnosed. It is a mood disorder where you have two moods. So you have the depressive phase and then you have the manic phase. Bi means two, right? So when we say biannual, it means twice a year. So bipolar, they have two moods. What I'm trying to refer to is that they sometimes don't have the energy to do anything. They feel really depressed. They don't want to do. They can't get out to do anything at all. Then they become manic, where they're running around. They can't sleep. They might be working on 2 hours of sleep in 2 days. They might be going out doing things that they shouldn't be involved in. And then we're going to talk about the signs and symptoms also. 25% of all suicide that happens are people with bipolar conditions. So we're going to talk about signs and symptoms, some of the things that they tend to manifest when they have this condition, so that when you see it, you'll be able to identify and then engage the person in the conversation or yourself to be able to seek help. Now, when you have bipolar, you have an inflated self-esteem. You tend to believe in yourself so much. You tend to have this hype about yourself where it's very unrealistic, right? You tend to get on to think that you are a star, you get things going for you, you have that inflated self-esteem. And then you also have decreased sleep. You can go for about 2 days without sleep, or about a week and then be sleeping only 6 hours. Okay, and I'm not referring to where you have a project where you really have to be working on, and therefore you're doing sleepless nights to work on those projects. That is not what I'm really referring to. Though it's bad for your health, these people are people that engage in most cases really not so fruitful ventures, and will be going for 2-3 days without sleep or very minimal sleep and still feel okay. They don't feel tired. They still have a lot of energy and keep going. They become very talkative, and they also have pressured speech. So they tend to speak very faster and then also speaks a lot. So they start on a topic and don't stop. They keep going and keep going and keep going. They also have flight of ideas. So they will start from one topic and then end up somewhere else. So we'll be talking about, an event coming up, and by the time you realize they're talking about events that happened in school, a soccer game that is happening, and they even move to different fields of conversation altogether. They have flight of ideas. They're very all over the place and sometimes difficult to redirect. They're also easily distracted. So anything that happens around them will distract them easily because they are so hyper that they can't focus on one thing. They may leave the house for some days and then go on a road trip or get on a plane, fly somewhere else. They might be gone for days without telling anyone, and they probably might not even know what they're doing or where they're going. So it is very important that anytime you see someone who is manic, we really keep an eye on them. If not, by the time you realize they got in a car in New York driving to California. They also have increased psychomotor and agitation. They try to get work done. So in the house where they live or where they work, they tend to overwork themselves. So they'll be engaged in cleaning the house, making sure that it's spotless. Even in the middle of the night, doing dishes. They will stay up and do anything at all possible just to keep them going. They have excessive involvement in activities that is high, so high in energy usage. So they tend to burn a lot of calories during their manic phase. They also have periods where they engage in sexual activities without really conscious effort. They don't put much effort into it because of that self-inflated self-esteem. because of that manic phase. These are some of the activities that they engage in and really do not have any pleasure in it, and then after the whole thing they really regret. They also go on a spending spree. So we had one patient that bought sticky notes. She bought $500 worth of sticky notes, which she really did not need. We had one patient who also maximized all her credit cards and used every single penny that was on it, buying things that she did not need and did not really know why she was buying it. We have also seen patients where they go on buying cars, right? So the things that they tend to buy depends on how much funds they have access to. Some of them will even go to the extent of selling some of the things that they have just to go buy other things that they really do not need. But just because of the mania that they have, they just have that sense of going and buying and spending and then feeling high on doing all those activities. They also tend to use a lot of drugs. Unfortunately, they do that to compensate for the symptoms that they have. So they tend to be drug abusers also. And then some manic episodes are also as a result of treating depression. So they feel very low, and then you try to boost their esteem or boost their mood up. So in doing so, it sends them into a manic phase. There are so many kinds of treatments out there for them, but then, as I always say, the goals for the video is for us to be able to talk about what we have, be able to engage in those conversations, and feel free to seek treatment. I'll briefly mention some of the treatments, but then I will advise that you seek for a professional opinion, go for counseling. There are psychotherapies that we use. We use cognitive behavior therapy, individual therapy, family therapy, group therapy, and there are also medications out there that can help with these disorders. So please do not suffer alone or do not suffer in silence. Please get out there, seek for help, and then help is readily available so that you can be able to live a normal life. One thing that happens is these individuals really do not even can't tell when they are happy, just happy and not manic, because there is that fine line between the two. So without treatment, you keep going and then think that you're having fun, you're enjoying, but then you're really at that manic phase. So with treatment, you'll be able to get some level of happiness without being manic. On this note, once again, please go ahead and subscribe to the YouTube channel and then click on the like button so that you will receive any notifications whenever we release a video. And then also follow us on Facebook, and then share these videos so that your loved ones would not also be a victim of any of these disorders. Thank you very much.